Welcome to our pre-recorded diabetes webinar that we also like to call our virtual diabetes cafe. We hope you enjoyed today's presentation. My name is Angelina, and I'm a registered nurse and certified diabetes educator with the Credit Valley Family Health Team Diabetes Program. For today, we'll be going through many different things. The agenda is split into different sections. We'll be discussing myths and facts about diabetes, what is diabetes, basics about blood glucose, and preventing complications. Just so that you are aware, if you need any resources or some good reading materials, we do all of our education based on the Diabetes Canada guidelines. And this website is right at the bottom. We will be providing the link to our website at the end of our session for you to access all of our resources. Here's an interesting question to think about. 30% of people in Canada have diabetes or prediabetes. True or false? The answer to this question is true. Prediabetes is another important diagnosis that indicates a higher risk of developing diabetes. So yes, it is correct, about 30% of people in Canada do have diabetes or prediabetes. Let's get started. What is type 2 diabetes? Type 2 diabetes is a disease in which your pancreas either does not produce enough insulin or your body cannot properly use the insulin that it produces. If you have type 2 diabetes, glucose or sugar will build up in your blood instead of being used as energy. If you look at this photo, the lady on the left is eating an apple. The apple is going into the stomach, and the apple is considered to be a carbohydrate. So it will turn into glucose or sugar, and it will move to the blood. The pancreas, which is the specialized organ that releases insulin, can pick up the sugar out of the blood and will move it to the other tissues to be used as energy. There are three major types of diabetes, which consist of type 1 diabetes, type 2 diabetes, and gestational diabetes. I'm going to talk about each of these types briefly, just so you can get a sense of their differences. For our diabetes program, we provide education to patients living with type 2 diabetes. Type 1 diabetes can be described as an autoimmune disease. It is commonly known as insulin-dependent diabetes. In this population, the pancreas is not producing insulin at all. This means it is not functioning, and in order to survive, the patient has to take insulin injections. Currently, it affects about 10% of the population living with diabetes. Type 1 diabetes generally develops in childhood or adolescence, but in some cases can also be developed in adulthood. Type 2 diabetes is the most common. About 90% of people with diabetes have type 2. Type 2 diabetes is mostly common in adulthood, although it can also occur in childhood as well. This is when the pancreas is not working as effectively as we would like. The pancreas is either not producing enough insulin, or the body cannot properly use the insulin as it should. Type 2 diabetes can sometimes be managed with healthy eating and regular exercise alone. If diet and exercise alone does not control blood glucose, then oral medication or insulin therapy may be required. The last type is gestational diabetes. Gestational diabetes occurs during pregnancy and is usually temporary. Once the baby is delivered, the blood sugar levels generally return to normal. Here's another interesting question to think about. True or false? Stress causes diabetes. So this is a tricky question because the key word is cause. Stress does not actually cause diabetes to happen, but it can be a major contributor to the development of diabetes. So the answer is false. Unfortunately, stress is an inevitable part of life, and we realistically cannot completely erase it. This is why it is so important to develop different strategies that can help us cope with stress in a way that can help to heal ourselves. Finding positive ways to cope with stress can have major benefits on your health. As you may know, you can have type 2 diabetes without any obvious warning signs or symptoms. The earlier that you are diagnosed, the sooner that you can take action to stay well, not only for now, but for the future as well. Some diabetes risk factors can be managed or reduced, while other factors may be beyond our control. For example, you have a greater risk of developing type 2 diabetes if you are over the age of 40, or if you have a parent, brother, or sister with diabetes. Our ethnic background is also a factor. Being of African, Arab, Asian, Hispanic, Indigenous, or South Asian descent can also increase our risk of living with type 2 diabetes. Having any of the following risk factors increases your chances of developing diabetes: family history, age, ethnic background, lifestyle, high levels of cholesterol or other fats in the blood, prediabetes, gestational diabetes, and obstructive sleep apnea. What's important to note is that anyone over the age of 40 should be tested for diabetes every 3 years. If you have one or more of the risk factors, you should be tested earlier and more frequently. Different organs that impact diabetes. Just to give you a visual, we have this picture here so you can see exactly where the different organs sit in your body. You can see the stomach on the one side and the liver on the other side beside the stomach. Our specialized organ, the pancreas, sits just underneath along with the intestines. These organs all have different functions when it comes to diabetes and managing blood sugar levels, and I will talk briefly about each of them so you can get a better understanding. For example, the liver's role in diabetes is that it stores and releases glucose or sugar in our blood, especially when we are not eating. All our organs require glucose in order to function properly, such as our brain, our heart, and our muscles. In instances where we fast for periods of time, our liver will release excess sugar to provide energy to these areas. Sometimes this can cause our liver to become overactive or leaky. This means that it is releasing too much sugar. One of the first medications that is prescribed for type 2 diabetes is called metformin. This medication works with the liver to reduce the amount of sugar that is being released. The other important organ to discuss is the pancreas. The pancreas has many roles with diabetes, but it has a specialized cell called beta cells that produce insulin. In diabetes, either the pancreas isn't able to produce enough insulin, or the insulin that is being produced isn't working very effectively. Now we will review the hormone insulin. This is a great visual. On the top, we have one image of the stomach during digestion. You can see that the glucose is moving into the blood and the pancreas is releasing the insulin to match and pick up the glucose and move it from the blood into your cells or muscles. On the bottom, again, another great visual. Sometimes we would like to suggest that the insulin is a key that unlocks the cell so that the sugar can move from the blood into the cells. When we are not using the insulin effectively, the sugar is not being let into the cells and can cause a buildup or excess of glucose in the blood, which can lead to complications to our organs. So initially, when we're first diagnosed, the doctor may ask you to fast and get some blood work done. Someone who has a fasting blood sugar of 7 millimoles a liter or greater in the blood is indicative of diabetes. The other test that is done is called a hemoglobin A1C, also known as the A1C. This is a 3-month average of your blood sugar. How they do this is by looking at the hemoglobin, which is the red blood cell, to determine how much sugar is stuck on that cell. A diagnosis of type 2 diabetes is made if you are 6.5% and over. If you have prediabetes or are at risk of developing type 2, the results would be between 6% and 6.4%. Anything under 6% is considered to be a healthy A1C. It's important to note that a second test must be done in all cases, except if you have any acute signs or symptoms of high blood sugars. Here's another great question to think about. True or false? If your blood glucose returns to target levels, you are cured of diabetes. I wish I could say this is true, but the positive part that is, if your glucose returns to target levels, it means that you're managing very well. So that is our ultimate goal. We want to provide you with education so that you can get your blood sugars to target levels to keep yourself safe and free of complications. We'll go over and discuss the basics of monitoring. We can ask ourselves, why should we monitor? Knowing your blood sugars is the best way to know if your diabetes is controlled or not. Checking your glucose levels can determine if you have a high or a low blood sugar level at a given time, and it shows you how your lifestyle and your medication can affect your blood sugar levels. You will require a prescription from your family doctor in order to submit to the pharmacy. Make sure to check your coverage to know which type of glucose monitor is covered for you. The frequency of checking your blood sugars is individualized. You should discuss this with your family doctor or your diabetes education team to see how you should proceed. There are two main types of systems that we can use to check our blood sugars. The first picture at the top is somebody doing a finger poke and checking their blood sugar. They'll use a glucometer and a little lancing device to poke their fingers, and the blood would go onto a test strip. The reading will then come up on the screen and you can see where your blood sugar is at that moment in time. The bottom pictures are relatively new systems compared to our glucometer. We have been using it for a little while now, and it's definitely becoming more common. They are called continuous glucose monitors, and there are two different kinds that we will review. The most recent versions of these are called the Freestyle Libre 2 or the Dexcom G7. Essentially, you wear a little sensor on the back of your arm or on your stomach, depending on the device. The sensor is about the size of a toonie, and you don't feel it when you wear it. You can use either a reader machine, or you can use your cell phone by downloading an app to track your sugars in real time. You can test your blood sugars as much as you want, since that little sensor will pick up your blood sugar reading every minute, which is very handy. All of these will require a prescription from your family doctor unless you are paying out of pocket. So this is something that we will always ask to see what kind of coverage you have in terms of benefits. And our team would review this with you as well as discuss the recommendations for testing if this is something that you're curious about. Previously, I mentioned glucose targets. So let's discuss what the normal blood glucose targets are. Before we have a meal, especially in the morning, before you have breakfast, we would say to check your blood sugar levels and ideally have a reading between 4 and 7, which is the target that we are aiming for. The next target we have is checking your blood sugars 2 to 3 hours after eating a meal. The range that we would like to stay in is between 5 and 10. If your A1C is elevated, we usually would recommend to tighten up your after meal targets between 5 and 8. Again, frequency is individualized and is something to discuss with your family doctor or your diabetes education team. We would also ask if you have a meeting with us to bring your meter to see how your blood sugar readings are. Again, here's another great question to pause and think about. True or false? Type 2 diabetes can often be a silent disease and have no signs or symptoms. And the answer to this is yes. So absolutely, it is called a silent disease because often people will feel perfectly fine. Sometimes people will even have some symptoms, but they associate it to other things. One example is a person might say that I'm really tired, but I don't sleep well at night, when extreme fatigue or weakness is actually one sign of high blood sugars. Let's talk a little bit more about those symptoms of high blood sugars, which some people do feel. Some consist of unusual thirst, frequent urination, extreme fatigue, blurred vision. Sometimes people will notice a change to their eyesight and they might think about going to get their eyes checked. They might think that they need a change in their prescription if they wear glasses, but that could be a symptom of diabetes. If you see on the right side, there are a few other symptoms that could be a sign of high blood sugars, such as headaches, weakness related to fatigue, or dry mouth that may be related to thirst. If you have diabetes, you should try to keep your blood sugars as close to target range as possible. This will help to delay or prevent complications related to diabetes. High blood sugar levels in your blood over a long period of time can cause serious damage to your blood vessels. This increases the risk for heart disease, heart attack, as well as stroke, eye and vision problems, including blindness, kidney disease that can lead to kidney failure and dialysis, high blood pressure, neuropathy or nerve damage that can cause tingling in the hands and feet, leading up to amputation. But there are things that you can do to prevent these risks of complications. This brings us to the importance of screening as a part of your diabetes care. Ask your doctor about tests for your heart, your feet, your kidneys, and your eyes. For the eye exam, we recommend to do that once a year. What is highlighted in this test is a retinal eye check, and what they're looking at is the retina in the back of the eye to make sure that it is not being impacted by the sugar floating around the blood. So that is a once a year exam, and it is covered through the government to the day, so just be mindful of that. The middle one is the kidney function. We do that through blood work. We want to make sure your kidneys are functioning well. Kidneys do have little vessels, like the retina, that can be impacted by the extra sugar floating around and can start to do damage. We want to make sure that you are monitoring your kidney function, and this should be done once a year through blood work. A foot exam should also be done annually by your family physician or your diabetes team. A monofilament test usually is part of the exam. That is when the doctor or the diabetic educator uses a thin filament to test whether you have full sensation under the feet. So we would want to look out for any issues with the feet or any changes, any sensations of numbness or tingling, or burning, which can be a sign of diabetes affecting the nerves of the feet. We also look at the nails. Any problem with the nails, such as darkened nails, which could be a sign of fungus infection, calluses, or corns, should be addressed by a foot care specialist in order to prevent any further damage. People with diabetes do tend to have slower wound healing time and are more susceptible to infections. So if you see any changes to your feet, such as change in color, temperature, or just to the way that it looks, book an appointment with your family doctor to make sure to get the appropriate treatment sooner rather than later in order to prevent any worsening of a wound or infection to the foot. Now, this is a very important question. People with diabetes can live a normal life. And the answer is absolutely true. We want you to live a normal life and to prevent any complications from occurring. That is why we want to give you strategies to lower your blood sugars and to prevent any complications from occurring. One way that you can be proactive and manage your diabetes to live a long and healthy life is by taking care of yourself each day. The ABCDESs is an excellent tool that you can use to keep everything in check and reduce the risk of complications. You can find a link to this tool on our website, and the link will be shown at the end of this video. The A stands for A1C. The A1C is the lab test that measures your average blood glucose levels over the past 3 months. The target is usually 7% or less. The B stands for blood pressure. The target for this is 130/80 and below. The C stands for cholesterol. We look at the good and the bad cholesterol. The LDL is the bad or the lousy, and that is recommended to be 2 millimoles and less. The HDL, which is the good or the happy cholesterol, is recommended for males to be over 1 and females to be over 1.3. I would like to mention about this slide that the ABCs is also called the tricky trio. So if somebody has an elevated blood pressure, for example, it may actually be harder to control blood sugar and cholesterol levels. So all of them do have an impact on the other. This is why we want to do is to get them all under control and within the target levels that are suggested here. The D stands for drugs or medications. Make sure that you are taking your blood pressure pills, your cholesterol pills, and your blood sugar medications. We come across many people who say they do not want to take medication, and the important thing to recognize is that these are tools that we can use to get your blood sugar to target as quickly as possible. Again, this is important because what I mentioned earlier is the longer that you have extra blood sugar floating in your blood, you are considered to be at higher risk of having complications affecting your body. Managing diabetes may seem like an overwhelming task, but learning how the different medications are used to manage diabetes is extremely beneficial. Treatment plans can change depending on the type of diabetes and who you are. Some people can manage it with healthy eating and exercise, or with medications, while others may need the hormone insulin. It is important to talk with your family physician or your diabetes team to learn about the different roles of medications. The important takeaway message is that taking medication for diabetes is not a sign of failure. It is necessary and is used for prevention. It is important to take your medications for diabetes and any other healthcare problems, even when you are feeling good or you have reached your blood glucose, blood pressure, or cholesterol goals. These medications help to manage and control your ABCs. Our final visual is the wellness wheel, and you can see in the middle there is you. The yellow section around the me circle is the tricky trio that we discussed: the A1C, the blood pressure, and the cholesterol. If you look at the other areas surrounding the tricky trio, those are the different areas we talked to you about being able to manage your blood sugars. So healthy eating, reducing any risk of heart disease, monitoring blood sugars, whether it's finger poking or flash glucose monitoring, taking medications consistently, and if you are experiencing any side effects from your medications, or if you don't feel good on certain medications, this is definitely a discussion with your family doctor, your pharmacist, or your diabetes educator. Instead of stopping everything, follow up, because we have a lot of really great strategies and tips on how it may work better for you, or perhaps changing the medication to something that you can tolerate better. So there is a lot of problem solving, coping well, strategies for managing stress, and of course, one of the best medications of all is being active. Thank you for taking the time to listen to this presentation. You can find the list that includes all the resources mentioned in this webinar on our website, www.cvfht.ca, under the Diabetes Prediabetes Management banner. Just a quick note that if you have been booked with one of us for an individual telephone appointment or in person, we are looking forward to seeing you then. Thank you for listening, and take care.